Thank you very much. And I wanted to welcome everyone to this session. It's actually our second session. And I want to thank all the service providers and organizations that have supported, worked with us, partnered with us in the past, currently, and in the future. My name is Jim Inglis. I am the co-chair of ProsperUs, and my counterpart, Janice Capper, who's CEO from Hotel Do, is also a co-chair of ProsperUs. And prior to getting into a little bit of background about why I'm involved and what it means to me, I wanted to take an opportunity to do a First Nations land acknowledgement. And so on that note, ProsperUs is committed to inclusivity and respect of all people as they take action to end childhood poverty within the community. As part of this commitment, we read land acknowledgement at the beginning of every meeting. And so let's begin today's meeting by acknowledging that the land on which we gather is the traditional territory of the three Fires of Confederacy of First Nations, comprised of the Ojibwe, Odawa, and the Potawatomi. And before we take a moment of silence, I wanted to reinforce why. Why is this important? And really it's centered around the following: to commemorate the Indigenous people's kinship to the land, to recognize the inherent right to land that Indigenous peoples hold, to acknowledge the attempted genocide of Indigenous people in Canada and injustices against them, including the broken treaty relationships, residential schools, and the 60s scoop, and finally to recognize how systemic systems of power have oppressed Indigenous people and how this has influenced the way non-Indigenous people perceive and interact with Indigenous people. And so if we could take a moment of silence. Okay, thank you. So for me personally, why am I part of ProsperUs? Well, first of all, it's to give back to the communities that I live in and that I work in. I actually have 22 branches for the BMO organization. And so we serve many customers from different communities and different backgrounds. And so there's that lens, but from a personal perspective, I have a child that goes to school in the inner city. I can appreciate some of the challenges, and quite frankly, I see how some children have an advantage. And for me, it's important that I choose to do something personally, even outside of my organization, and that's one of the reasons that I'm involved in ProsperUs. And from the company that I work for, the values that I hold and the values of the company are well aligned. And one of our purpose actually at BMO is to boldly grow the good in both business and life. And I feel this is one of the ways that we do that. And I do this as an individual, either me as Jim Inglis or me representing BMO as Regional Vice President. And so that gives you a little bit about the why. And of course, the need is great without saying it. In terms of the last couple of years in our community, what I can say is we're early on the solution and the design, which we're going to hear more today, and the creative career strategy and the opportunity to help our community and our neighborhoods, and the three neighborhoods that we decided to support based on the approach that we used, really makes me excited because we're getting closer to getting into putting in solutions in the respective neighborhoods, and we're certainly not doing that alone. The community action networks, the input from those various networks in those communities is and will continue to influence and shape what we decide to do, and obviously input from and working with our service providers that are joining us today. And I guess the final thing that I'd like to perhaps share before I pass it over to Lorraine is just the importance of the need that we have now, and really kind of approaching and thinking differently about the way that we've tackled opportunities to make a difference. And ProsperUs is really designed to look at things differently, but certainly with the current challenges that we have with the pandemic, I think it's just ratcheted up even more, not just from a need perspective. I think we all would agree that the spotlight shone challenges together so that we can have impact and make change and get to action. So on that note, I'm going to pass over to you, Lorraine.
Great. Thank you very much, Jim. And thank you for your, dedication to this vision, not only your own, but BMO's and your leadership. You've been integral to the work that's been accomplished to date, and we're really so happy to have you a part of this. So thank you for that. I'd like to welcome everyone, and I see some familiar faces, and if you don't have your camera on, I'm seeing some familiar names, so it's great to be able to present to you today. I'm sure you have all experienced some unique challenges due to the pandemic, and of course, ProsperUs is not immune to that. With the COVID-19 and needing to respond to the immediate needs resulting from COVID-19, the work of ProsperUs was put on hold for a little bit, and we had to really pivot the way that we connect, as we're all doing, the way that we interact with people. And we are back on track, but it is, and I would assume you would agree, it's a little more challenging when you're doing everything through the camera. But we are going to persevere, and we are going to continue to move forward because this is really important work, and we feel that you and your organizations are an important part of that as well. So I'm going to kind of just level set everyone and just make sure we're all on the same page, understanding kind of what is the vision and what's so different about ProsperUs and what we want to accomplish. I'm going to hand it over to Carleen, and Carleen's going to talk a little bit about, again, there's a lot of new ways of working and the work that she's doing with our community action networks. And then Alicia will join us in the presentation, and she'll talk about, the role of the service providers and the work that would be undertaken and how you may be a part of that. So I would ask you if you could remain on mute. And we will have Q&A at the end of this session. However, there is a chat box here as well, and feel free to, if you have a question in real time, to enter it into the chat box. And I know that Alicia is monitoring that as well, and she'll do her best to respond to it. Because we want to commit to ending this meeting on time, if there are questions that we don't get to, make sure they're in the chat box and we commit to responding to them after the meeting. And we will be recording this session because there may be some folks who just couldn't make either session, and we want to be able to ensure that they're given the information as well. So today we're really going to just again highlight ProsperUs and the collective impact methodology, provide an overview of the Cradle to Career community vision, discuss the solution design process and our work to date, and share how organizations will be engaged in the process, and then do a little Q&A. So we will move on to the next one. So essentially, there were a number of us organizations who really asked the question, what would it take a generation from now for Windsor-Essex to be a more prosperous community? And we looked at the data and seen that despite all of our best efforts and the millions of dollars that are being invested in a variety of community services, there were some data sets that were just going in the wrong direction. And these are, definitely complex or wicked problems that we really started to think about and said, we probably, the way we're dealing with them is clearly not working. And so maybe we really need to kind of take a different approach to begin to solve some of these problems. And so the next slide, when we really looked at the data, we couldn't deny that you know, we all want the same thing for our children, right? And that's an opportunity to have a shot at what we call the Canadian dream. And that, you know, we should, a country as prosperous as Canada, we should all have the same opportunities to succeed no matter where we started in life. But unfortunately, that's just really not the case. And so even though our Canadian economy is really strong and we have a lot of, you know, dedicated organizations doing some really great work, it's still not moving the needle. And, you know, for children growing up in low income families in particular, really, they don't have very good odds at achieving a higher standard of living than their parents. And what we really learned through our research, our local research, is that the roots of economic opportunity really do lie at the neighborhood level. So when we look at some data, and I acknowledge that this data is from the last census period, so it is a bit old. We know that Windsor-Essex, generally, the poverty stats are 23% or child poverty growing up in low income. And when we compare that to Ontario at 18 and Canada at 17, we know that, you know, we really need to do a bit better than what we've been doing. But we also took it a step further and we mapped childhood poverty according to municipality in the county and by ward in the city. And the greater number of white dots means the greater number of children living in poverty in those communities. So, you know, there are a few neighborhoods there that really jump out. And, you know, when we looked at other data along with that, in some of these neighborhoods, you know, it's as high as 1 in 2 kids growing up in low income, and less than 30% are meeting provincial standards for grade 3 literacy. And the research tells us that if you're not meeting provincial standards in grade 3 literacy, you're 4 times more likely not to graduate high school. So there's some really big challenges ahead. So we said, okay, what do we got to do differently? Like, what can we do differently? And I'm sure all of you are familiar with collective impact, but for those of you who maybe are less familiar, you know, it's a methodology that is really designed to tackle kind of complex social problems so that you can actually get to some population level outcomes. So if we look at the left-hand side of that slide, you know, that's kind of our system today, right? We have lots of programs and, you know, they're kind of like working together a little bit, but, you know, mental health is working together more, and maybe, you know, the people who deal with food insecurity and, you know, different sectors. But when we really look at something complex like childhood poverty or childhood success, we don't really have the same vision. We're not aligning our resources or our work. We're not measuring the same things. And, you know, we're all kind of in our own boat, rowing in whatever direction we think we need to. And what we want to do is move to the illustration on the right-hand side, which is if we're trying to tackle, you know, children and youth success, then we really need to be able to line up our resources, line up our work, have a framework through which we connect to each other, measure the same things, and then really take all of that energy and force and effect to be able to really make those population level outcomes. And that's really what collective impact is about at a very, very high level. So we started with establishing a collective group called ProsperUs, and that they came together in 2018, and they are some of our community's most influential leaders, and they've made a pledge to stand shoulder to shoulder to tackle this wicked problem, to not only just come to meetings, but to invest dollars, to invest their staff resources, their time, lend their expertise, to be able to really kind of tackle this problem in a meaningful way. And so ProsperUs is about creating a more prosperous community for all of us. And it is a cross-sector representation of nonprofits, government, healthcare, education, labor, business, and community members. with a shared vision that we are going to really move the needle on this issue. And so right now we have 50 members, and they are, I know it's very tiny print, so my apologies, but it is representative of some business, higher education, pre-kindergarten to grade 12, government, labor, nonprofits, public sector, so on and so forth, and continues to grow. And how we work together, and this is an illustration, it looks a bit confusing, so I'll try to simplify it, is at the center of our work is children and youth in our community. The outer circle, the orange one, is a community at large, whom we're all accountable to at some level. The white ring is a leadership council, which is the decision makers. So those 50 people, ProsperUs Leadership Council, they are the decision makers as we move this agenda forward. The little blue circles, what we call our community action network tables, and those are neighborhood focused on key neighborhoods and are comprised of, and I don't want to take any wind out of Carlene's sails, but one of them is the residents in the neighborhoods. And then the blue ring is the investors table. And again, we really want to shift to being a strategic investor and bringing investors to the table to really undertake what we would like to call catalytic philanthropy, to really make real big changes, to really improve outcomes. And so it's a totally different way of working with corporate partners and philanthropists and foundations and such. And that table will be launched, late spring, early summer. And then in the bottom, you'll see those small little boxes. That's the backbone. That's the role of United Way. And to simply describe it as, I would say we're like the engine driving the work forward. The Leadership Council is the decision makers. And so each one of those boxes is kind of like a bucket of work that is being undertaken and led by a backbone team at United Way. But those committees are also comprised of our partners, their staff. So this isn't just a bunch of people coming around a table and saying, sure, I'll come to a meeting once a month and I'll give you my 2 cents. It's really about making an investment, putting dollars on the table, putting time, putting their own staff resources on the table to help us move this forward in a very meaningful way. And all of this is really, those arrows is really about, we're always striving to do it better. So we're always in a continuous improvement mindset, no matter what it is, whether we're engaging, whether we're researching, whether we're investing, whether we're implementing. We have a real mindset that we can always evaluate and improve upon our work. And so the work that we are going to be doing is developing what we call a Cradle to Career strategy in key neighborhoods. And this Cradle to Career strategy has been implemented in 70 communities in the US, and they've experienced some really significant success. One of the communities, you may have heard of the Harlem Children's Project, and they've had some significant success. Bill and Melinda Gates Foundation has invested millions of dollars into their Cradle to Career strategy, which is in Harlem, New York. So it is tested. We believe this is the first time it's coming into Canada, and within the Canadian context, we're adapting it. But what this vision really fundamentally believes in is education is one of the clearest pathways out of poverty. And we have 6 milestones that, give us a kind of a roadmap through which we can measure our success. And the first one is that increasing the number of children who are kindergarten ready. And that means, intervening even into prenatal, right? Because we all know that if a child is born with a low birth weight, it has potential consequences across his or her lifespan. The next 2 milestones, 2 and 3, and you can see they're in the boxes because today what we're talking about is designing for those 2 milestones. And the first one is improving grade 3 proficiency in reading, and improving students' proficiency in math in grade 6. So I already talked about if you're not proficient or meeting provincial standards in grade 3, what will happen. But if you're not proficient in grade 6, you're less likely to attend post-secondary. And we know jobs in the 21st century economy really are going to require college, university, or trade. The fourth milestone is high school graduation. And I think we would all agree that if you don't have minimally your high school graduation certificate, you probably will be living in poverty. Milestone 5 is about transitioning more young people into post-secondary and be career ready. So getting into post-secondary where they can actually get a job that would be life-sustaining. And then the last is about ensuring when a young person graduates that they are in their career that they studied for within a year, because research tells us that if you are not making that transition into your job within the first year, your lifetime earning potentials are generally lower than your counterparts. So this really looks like it's all going to be about after school programs and tutoring, but it really is about looking at how we support young people through the lens of our social determinants of health, right? So we want children to get through their education. We want, young people and their families to have employment that earns a living wage, economic empowerment. We want to ensure that young people and their families have access to healthy food, sufficient food and nutrition. They have the social support. They're included in society, that they have safe and affordable housing, and that they have access to physical and mental health care. And it's all of those things that we look at to be able to ensure that children and youth are positioned for success so they can be successful in school throughout their educational careers. So one of the things that ProsperUs first did was we looked at data and we created a youth index that had 20 indicators that measured youth success. And we mapped those across, I say 55 neighborhoods across Windsor and Essex County. Those neighborhoods were divided so that they had some equal population. And then we measured those indicators, and what emerged was there were clearly 3 neighborhoods that had the lowest opportunity for youth, so the most barriers and the greatest number of barriers and the lowest achievement. And those are West Windsor, Downtown Windsor, and Leamington. So we will be focusing our efforts in this first, phase of Cradle to Career into those neighborhoods, and really looking at our investments through the lens of equity, right? So United Way has been, I think we should go to the next slide, Alicia. United Way has been an investor in our community for almost 75 years. And, we have given a lot of money out to a lot of different organizations, and, we have helped a lot of people. But when you have such a complex problem like poverty or childhood poverty, we can't just sprinkle dollars around and be, an inch deep and 10 miles wide and expect that there's sufficient resources in order to really move the needle. And the government's been that way. And, I think traditionally that's just the way, funding has been allocated. And so what we're talking about is, recognizing that there are just some young people who are so far behind that to even get them to the starting line where their peers are who aren't facing those barriers requires way more resources. And so we need to be like a mile deep and a couple inches wide in our investments. And we talk about catalytic philanthropy. That's part of what we're talking about here, is that, making significant investments sustained over a period of time very strategically and through the lens of equity. So kids get every opportunity to be successful like their more affluent counterparts do. And so that's really a big piece of the how we're going to do that. So I'm going to turn it over to Carleen now, and she's going to talk about our community engagement strategy. Carleen, over to you.
Great, thank you so much, Lorraine. Hello, everyone. It's really great to be in front of you this afternoon. As Lorraine said, I'm Carleen. I'm manager of community engagement as part of the team here and the backbone team at United Way. And just over the next couple of slides, I'm really gonna unpack for you how we've taken our beginning steps towards this very ambitious vision for our community, through the mechanism of community engagement and some of those activities. So here we're looking at a very simple representation of what we call the Community Action Network, which is our vehicle for engaging the community in our Cradle to Career Development. The CAN is comprised of working groups that represent each milestone and priority neighborhood. So because we're starting off with milestone 2 and 3, in this pilot phase, you see 3 working groups there across each of those 3 priority neighborhoods. We formed these groups in November 2019. But before we did that, we of course engaged in a pretty robust open engagement plan where we were doing door knocking. We did flyer distribution in the community. We attended many public events, barbecues, farmers markets, that kind of thing, in each of the neighborhoods. And of course, we paired that with social media and email engagement campaigns. And we required members to fill out an application. And of course, the restrictions just being around, do you live in the neighborhood? So are you a resident there? And do you have milestone age children? But of course, we also looked at how members are representational of their community demographics. And we had some questions then there along the lines of life experience with special sort of focus around their lived experience of poverty. So those were really the steps that we had taken during our recruitment. It was quite a lot of work, but it was very rewarding. We had, I believe, almost 114 applicants apply for what is 12 seats at each of the working groups. And when you look at the little diagram there on the left, the working group sort of dissection, you see that there are also seats for service providers. And so, of course, today we're talking to all of you because we want to talk about how providers will be added later into the working group format. But each of the working groups also has a chair, one from the Leadership Council Network, and one resident from each of the neighborhoods. And they hold a seat at the Leadership Council where they also have a vote. And of course, there are facilitators that help us facilitate those meetings and move the work along. And of course, before the pandemic broke, we were meeting in person, but we did take some time to pause when that hit to pivot, and we are meeting strictly online in virtual meetings. And overall, we recently completed an evaluation of what the experience has been like for our members at each of these working groups. And one of those things that we noted and we were really excited about was that we had an 89% attendance rate, even once the pandemic hit. So we're really pleased, and we've had some wonderful participation at this level from residents in our work. So if I can just flip to the next slide there. Thanks so much. So, as we undertake this work at this level through the community action networks, it's important to understand, and I think Lorraine might have touched on it earlier, this concept of human-centered design and how that's really underpinning the work that we're doing, at the forefront of our formation of our strategy here. Human-centered design is an approach to problem solving that empowers the end user in the design process. So, we're extracting from their lived experience. We've often called them context experts, right? They are the experts of knowing what it's like to live in these neighborhoods and deal with the challenges and barriers day to day. So we're really getting at the true needs of folks in these areas. And we always love this little image here on the left that, shows the beautifully laid brick path here that someone probably took a fair amount of time designing and care laying down. And it's clear that the cyclist here, who is a quite frequent user of this space, prefers that spot between the two trees. So again, we're doing the same thing here in our work by putting residents first around these tables. We're really hearing about what the true needs are, and putting that at the forefront of the work. So we've also taken some training and we've been giving our residents some capacity building sessions around this concept of human-centered design. And we've just completed training with all of our working groups to really give them the language and help build their skills as they dive into this in the new year when we work on our solutions. So those, those terms there on the right are steps of human-centered design. I'm not going to take you all through that right now, but that's really been a key point in which we've tried to give skills and empower residents with the language of how we do this work moving forward. And so if I can get the next slide there, Alicia, I'll just take everyone through where we've been in terms of forming and some of the big pieces of work to date. So of course, we in November, we did a lot of level setting, capacity building. It wasn't just about the human-centered design training. It was bringing them up to speed on all of the good things that ProsperUs has done, to get to this point. But we also did a pretty deep dive in on the data we have available at the neighborhood level. We took them, of course, through the stats that we had for the Coming Together report, as well as, just general stats on service access in the neighborhoods. And we really looked at the EQAO data, school by school in each of those neighborhoods. And then from there, each of the groups really dug in on their assets in their community. So, we're always looking at strengths-based approach in our work. And so we allowed residents to have really good discussions around those 6 social determinant of health areas where they feel the assets in their community have really helped milestone-age children and their families. And then also there was some great discussion about perhaps where assets are not being fully maximized or just aren't quite working for them as a community stakeholder, and where even in some cases there's some gaps, right? So where they're missing assets in our community. And we're just not helping children with certain issues along those areas. So that resulted in like 324 assets being identified, and they're all mapped and on Google Maps live. So those are accessible for the community. And so after asset mapping, we dove in on the barriers that prevent milestone-age children from succeeding in school. And again, keeping that lens of the social determinants of health and how we go about identifying those. After months of work, we actually identified 52 barriers across the communities. So that was quite a yield. And so, of course, we knew we needed a starting point. So we used a decision matrix technique to really identify and help our groups prioritize their lists. As you can imagine, there were some barriers that were specific to only the 3 communities, but of those that rose to the top, they were really common across each of the neighborhoods. And we'll look at those in the next slide. But but before we do, I just wanted to note that our backbone team really looked at the barriers they identified. We analyzed all the data that had been generated during that time with our working groups. And then we looked at, what are we seeing as an impact of COVID-19 in our community? How is that changing this a little bit, this conversation? And then from there, we connected each barrier to some, possible solutions. We looked at research on best practice. And, we used this to really decide where we were going to focus for our start in the new year for solution design. So these 3 barriers were approved. I'm going to show you that in the next little bit there by the CAN working groups in October. And then from there was approved by the Leadership Council in November. And then of course, the next piece is solution design. So right here, what you're looking at is those top 14 barriers across the working groups. Those on the left there that are like that light green, education, health, and food and nutrition will make up our solution design starting points in the new year. In yellow there, social support will be looked at once these 3 areas are either worked on for implementation planning or are implemented in the community. So once we've kind of made some headway in those 3 areas, we'll turn our focus on 2 additional barriers, starting with social support. For housing, because that's such a cross barrier or cross milestone issue in our community, we really wanted to make sure we had all of our milestone tables up and running so we could sort of pull a subset of members from across those working groups to inform the solution design at that level. And finally, in white there, in terms of employment and income barriers, we're looking at having those tackled within our youth community action networking group that is focused on milestone 4 and 5, because, you know, they're looking at post-secondary and career readiness and, you know, how that impacts income security. So, I mean, what you're seeing here is really just, this is a, you know, being done in rounds, right? We're not going to boil the ocean all at one time. We've got to tackle these barriers in a way that is, you know, both respectful of the priorities of residents and our need to make headway on these really key issues, but in a way that, you know, we're being efficient, we're being mindful of time, and we're testing out, you know, our solution design process. So if I could just grab that next slide. Thank you so much. Great. So here you are, drum roll. These are the 3 areas, and, you know, where this is a visualization of how we will really get this work done in that first round. So we're thinking that beginning in late January up until April, it will take us about that amount of time to have each of these solution design working groups work through, using human-centered design, the creation of some solutions in each of these areas. Each of the groups currently, you know, we have West Windsor, downtown, and Leamington. Right now, we're currently moving on shuffling our neighborhood resident deck chairs around from their neighborhood specific groups into these 3 solution design groups to do this work. Each will, of course, be joined by members of community organizations. You know, you folks, we'd also refer to you as the content experts, right? Because you know what it's like to work in the community and in these different spaces. So you bring all of that great knowledge and experience to our solution design tables. And finally, I guess I would just note that, you know, the last, I guess, stakeholder that we will engage maybe in and out in a fluid way would be the subject matter and expert community. So our academics might tag in at various points to help us design a really robust solution. So, and then off to the side there on the right-hand side of the diagram is just the output. So each of these groups will be looking at really, is this a new program or service we're designing? You know, a new service, new support, or is this us looking at perhaps a couple of different assets, looking at and changes that could be made to some of the components of the program or the scale of that asset? Or is this something that we need to really dig in on advocacy and make some advocacy plans to get progress on that barrier? You know, and just to further complicate things, of course, we recognize that solutions could perhaps involve a combination of those areas. So that's my, that concludes my piece on how we've really engaged the community to date. And I'm just gonna pass it over to Alicia now to cover how community organizations could be involved in our next steps for our work. And then I believe at the end, as Lorena has said, we'll have some time for questions. Thank you. Over to you, Alicia.
Perfect. Thanks, Carleen. Hi, everybody. It's nice to see you all and to have you together during these strange times. I know ideally we'd love to kind of have everybody, you know, in our boardroom or have everybody get together in a gym. And unfortunately, we just can't do that right now, but we do really appreciate your time today as we work through this. So like Carleen was saying, you know, we recognize that service providers are really key. You with your frontline expertise, you know, you have a lot to lend to this solution design process. So we wanted to walk you through exactly how we're going to engage service providers here. I know we're throwing a lot of information at you today, so we do hope, you know, if you have some questions at the end, we'll definitely take those. But also, I think a lot of this information might answer some of your questions that you have. So we'll kind of power through this information first, and then we'll take a pause and have some dialogue about this. So essentially, the role of the service providers at those CAN working groups are really to provide, again, that frontline expertise to the design process. So as a starting point, service providers will be invited to join the CANs to engage in that solution design process over the next 4 months. But we recognize that this is not the only role of service providers in this work, and that we, you know, will have plans to do various outreach activities just beyond this starting point as we're able to, you know, kind of within the realities of COVID-19 and the pandemic at this time. But for those service providers who do come to those CAN working groups, We're asking that organizations commit to actively participating in 2 meetings per month, as this work will move quite quickly. We're also asking organizations to work collaboratively, of course, with those residents with lived experience. So bringing together that context and content expertise that Carleen explained to us, and really contribute frontline expertise related to those specific milestones and barriers that we're focusing on as the starting point. And of course, what we're all trying to do at ProsperUs within this work, and what we're going to ask of organizations, is that we prioritize the experience of the service user, right, throughout the design process as our primary focus. We're working to, essentially redesign the system for the benefit of those that participate in it, that use it. And so that has to be our primary focus in all of this work. And so the journey that service providers will go through at this table and part of through this design process is going to be kind of in these 2 big buckets. So initially, the first step of this is really obviously happening right now and will run through April of 2021. And the focus right now is really on that high-level solution design. So of course, this is part of our outreach and information sharing, kind of hosting these public information sessions. What we also want to do as part of our outreach strategy to organizations is ask that everybody complete an organizational profile. And so we'll leave you with a link after the presentation, and we'll email this out as well to participants. But really, we want to understand the work that you're all doing in the community, because we're really trying to understand what organizations are doing work in what space. And we want to make sure that we can take this information and add this to those asset maps that Carleen was talking about that our CAN working groups worked really hard to put together. So we just want to make sure that we have a really good picture of the work that's happening locally in our community. And of course, all of that is so that we can identify organizations that are aligned with the work that's in front of us right now. And so we're going to be using those asset lists that were compiled by the CAN working groups, as well as all the information we could pull from 211, and all of the profile information that you'll submit, to really understand who is most aligned right now with the work that we're focused on, just for the starting point of milestone 2 and 3. And of course, the 3 barriers Carleen mentioned, which are mental health, out of school time educational programming, and food security. And then what ProsperUs will do is essentially finalize a list of organizations that most align, and they will bring them in and join the CAN tables to prepare for the design process. So there'll be a formal onboarding process for those organizations. There'll be a lot of pre-design work around sharing about best practices and innovative solutions that have been tested in other communities that we've yet to try here. And that would really be the level setting to then jump into the process that Carleen was talking about in the new year, which is really the bulk of January through April, where the high level solution design is happening directly with residents at those tables. Once there's some high level solutions designed, and when I say solution, I mean, it could mean a lot of things, right? It could mean programming, it could mean what we think of as, clinical interventions, but it could be other things. And so we use the term solution to really keep it open to the design that in the feedback that we hear at those CAN working groups. But essentially, when we have those high level solutions designed, what we need to do is reassess based on what those solutions look like, all of the assets that we have in our community that align with what the solution looks to be. And so that will involve obviously assessing capacities of organizations to potentially help implement these solutions. So basically going back to the drawing table, reassessing who needs to be at the table, who could potentially deliver some of these interventions or solutions, and then bringing those groups of people together in additional design tables that will really flesh out the implementation details. So that's all that tactical, like cost modeling, fleshing out details like where would this be delivered, who will be involved, and kind of the how of how we do that. And so that is to occur primarily in the late spring through the summer. And so you can see there's going to be 2 pieces in which organizations will be involved. Those organizations who will help with the initial design may not necessarily be at the tactical design tables, right? And vice versa. Just because organizations aren't involved in the initial design does not mean that once designs are produced, that those new organizations won't be tapped to assist with implementation. So just keeping that in mind. And of course, we have to evaluate alignment with milestone 2 and 3. And this is important for a number of reasons. And so, of course, we've already talked about we're kind of working within this new reality here within the COVID-19 pandemic. And like I said, our usual, what we would love to do is kind of get a gym, get everybody working in this space and in the sector together, organize really broad design days, right, where we could kind of be together for a full day and all dig in on this work. But unfortunately, right now, we're just not operating in that type of environment. And so in order to be able to move this work forward and to not, you know, stall our progress at all, we have to be able to create a way to get some organizations who can really meaningfully participate in this kind of virtual setting, right? But also keeping it manageable so that we can move this work forward and not be delayed. And so that's why we really have to look at alignment. And it's important that we prioritize those that most strongly align with these milestones at this time. So some of the considerations we're making, and these are pretty obvious, right? But just to walk through them, we are prioritizing right now organizations that are currently working within those milestone 2 and 3 spaces with middle years children, and organizations that currently provide direct interventions related to those 3 focus areas of mental health, food, and educational out of school time programming. So really honing in on who has, you know, the expertise right now to drive this initial solution design forward. And then we also want to, again, make this manageable, right? So where there may be duplication in service providers, we're going to ensure that we have organizations at the table that are local systems leaders in that identified focus area, or that are focused on serving a specific equity-seeking population. And so that's the lens through which we're looking at this right now. But this is just a reminder, we'll bring the Cradle to Career vision back, that our starting point is just milestone 2 and 3. That's where we're beginning right now with the middle years. Of course, our intention over 2021, though, is to establish working groups at each of these milestone tables for all of the neighborhoods. We've actually already started. Carlene has been working really hard to recruit resident members for the milestone 1 table. So we hope to have that up and running in the new year as well, with residents onboarded. And that will mean that there'll be more opportunities for organizations who maybe align better with some of these other milestones to get involved as we roll this out in 2021. So if you're looking at this right now and you're kind of thinking, you know what, our expertise isn't necessarily in the milestone 2 and 3 area, just know that as we continue to scale up this work over 2021, those opportunities will be there where you might better align with the work that we're doing. And so this is our timeline, our roadmap ahead. And we've walked through a lot of this, but this just sums it up for you. And of course, our timelines are always ambitious, and we're hoping for the best for 2021. But again, this is all subject to change depending on where we find ourselves with this pandemic and with all the other considerations happening. But of course, we've already launched our Youth Community Action Network, and they're going to start digging in on some work. Like I said, Carlene is working on that milestone 1 table, right? So we can start scaling up some of that work to a new milestone. Right now, we're really looking and focusing on getting organizations onboarded. And so that's where we're at this time. But rest assured that once we start digging into solution design in the new year, we do hope to be planning for implementing some new solutions throughout the summer for potentially a late summer, early fall implementation date for whatever the solutions are that we come up with at that time. And again, this is cyclical, right? So we're always going to be engaging new residents at new tables as we work through this, and working through more barriers as we've addressed kind of our top priority areas to start. So this will be the organizational profile link. I will email it to everybody after the meeting, so you don't have to write this down if you don't want to, but we do just want to put this out there that we are really looking for you to complete this. It's very brief, but it gives us a snapshot of the work that you're doing in our community, and that would really help us as we kind of roll things out in 2021. And of course, we're throwing a lot of information at you today, so if you do have questions that we don't get to, or maybe you think about them after our presentation, just connect with me at any time. My email address and my phone number is there. I'm happy to chat with any organization about your questions or your thoughts or any feedback you have on the strategy. So just know that there's a kind of an open invitation there to connect with me anytime. And then that will bring us to questions. So I'll turn it back to Lorraine, and everyone can feel free, if you have questions, to unmute yourself and turn your camera on if you'd like.
Thank you, Alicia, and thank you, Carlene. it's a lot of, it's probably information overload. So we will share this slide deck too with all the participants who attended both on the last week's session and today's session. So I'd like to open it up if anyone has any questions or comments or anything. So I'm not seeing any. That means we've either like just, you know, okay, great. Thumbs up from Mary Jo, very good. So obviously, like Alicia said, once you kind of settle this information in, if a question does arise, you know, feel free to reach out at any time. I would encourage you all to, once Alicia sends you the link to the profile, please complete the profile because that is the first step to getting us to move to having you engaged in our work and next steps. So again, thank you for taking time today out of, I'm sure, all of your busy schedules. And I hope everyone is staying safe. We are now in lockdown and hopefully the curve is flattened. And that if I don't connect with you before the holidays, I do wish you a safe and happy holiday season. And hopefully we will reconnect in the new year.